So we looked at the infraorbital artery briefly in the last video. So it's an artery that just comes out from the infraorbital foramen. There's a hole that's just underneath your eye. And what it does is it gives feeling or innervates the maxillary anterior teeth. It also gives feeling towards the upper lip, and it's the area over here, the lower eyelid and the side of the nose. So if you've ever had an infraorbital block, if you've ever had work done in this area over here, I know I have. I remember feeling numb underneath my eye, on the side of my nose. It was a very weird feeling that I had, and that's because I received an infraorbital block. Now let's look at the venous drainage. So veins, what they do is they take blood to the heart. Okay? So veins, they take blood to the heart. Arteries take blood away from the heart. Veins bring the blood back to the heart. And it comes out, so from the head and neck area, the veins all come out from this thing here called the jugular foramen. So jugular foramen is this hole or canal like right over here. And all the veins kind of pass out of the skull through this area over here, the jugular foramen. And when we're looking at the jugular foramen or jugular vein, what I want you guys to notice is that just like with the artery, we have an internal and an external. So internal, it goes deep towards the skull. The external is the one we're most interested in because this is the one that's towards the outside of the face. And what I really want you guys to know is that there is a maxillary vein. Just like there was a maxillary artery, there's also a vein that brings the blood toward the heart. And this is something interesting. This is called the pterygoid plexus of veins. Now note how there's like blood vessels or veins that's all intertwined, and it looks like this. This is known as a pterygoid plexus of veins. And the reason why I want you to know this is, and here's another picture, pterygoid plexus of veins that branches off of the maxillary vein. So the reason why I wanted you to notice is that sometimes if we get an injection in this area here, and if the needle is at an improper angle, so there was something wrong when the injection was done, you could develop something called a hematoma, which is like a blood bubble, like a swelling and discoloration of the area. Not a huge deal. I mean, it'll be there for a few days. It may feel uncomfortable, but it's nothing to be super alarmed about. But this can happen when the needle affects the pterygoid plexus of vein. So when we puncture it in a weird way. Now this pterygoid plexus of veins, which is this area over here, is very close to the maxillary tuberosity. And the maxillary tuberosity is like the area right behind the third molar. So right behind the third molar, so it's near that area. The pterygoid plexus of veins is near that area. So if a needle is if the vein is pierced by the needle at an improper angle, then we can get a hematoma, like we see in these pictures. Here over here, this is just something that I want you guys to review on your own, is that if we're looking at a lingual artery and we want to know what it supplies, well, here it tells us the lingual artery, lingual for tongue, well, it will supply the tongue, and it also supplies the floor of the mouth. The facial artery, what does it supply? Where does the blood go? Well, it go to the submandibular salivary gland, which we'll look at later on when we talk about salivary glands. It also goes to the skin and the muscle facial expression. So all of these are different types of arteries that are things that we looked at and what they supply. So if I ask you in a test, the mandibular teeth, what is supplied, or which artery supplies the mandibular teeth? Here's an image of all the arteries, and imagine that the lower teeth are here, the upper teeth are here, so mandibular teeth refer to the lower teeth. So the artery that supplies the lower teeth is the inferior alveolar artery, because this is the artery that supplies the lower teeth. If we want to look at the maxillary molars, okay, so molars, because it's towards the back of the teeth, well, let's imagine that there's the upper teeth here and the back teeth, the molars are over here. That is supplied by the posterior superior alveolar artery. And that's the answer. If we're looking at the tongue, which artery supplies the tongue? Which artery gives feelings to the tongue? Well, the tongue is over here, and I'm pretty sure it's the lingual artery that supplies the tongue. And that's what we see here. It's the lingual artery that supplies the tongue. So you can see here, soft palate. So here's your palate. The soft palate is always at the back. So the soft palate is supplied by the lesser palatine artery, and then the hard palate is supplied by the greater palatine. Okay, so the greater palatine artery. So this one just tells you what they're all supplied by. Veins, same thing here. So with the veins, which we can see which one is the common site of the hematoma. So hematoma is a blood bubble. Where can that happen? Well, we know it's the pterygoid plexus of vein. So if we put the needle incorrectly in that area, you can get a hematoma or a blood bubble. So this is just a good example of knowing where hematoma can happen. What is posterior to the maxillary tuberosity? So the maxillary tuberosity is the area right behind the last tooth, and the pterygoid plexus of vein is close to the maxillary tuberosity. Where does the veins come out from? From the skull, and it comes out from the it comes out from the jugular foramen through the internal jugular vein. So the internal jugular vein, it comes out from the jugular foramen. There's a hole over here where it comes out from. Okay, so these are just some answers of if I ask you in the test, where's the common site of a hematoma? Well, now you know, because the answer is right there. And these are some videos that I do encourage you to watch. That kind of he does a good job of showing you where exactly all the arteries are in the model that he has. You can see that he has lots of images over here, or models over here that correctly show all the different types of arteries and veins, and sometimes it's nice to see that in a 3D way. So he does a good job of showing you that. So if you want, this is an optional video for you all to watch. I do have a Quizlet game as well for you guys to play on Blackboard, so I do encourage you guys to look at that. All right, thank you guys.